panel discussion with some people who have experienced the pandemic from different positions and perspectives. Before I call upon our panel discussion moderator, Dr. Prashanth NS, Assistant Director, Research IPH, to moderate the discussion, I also would like to inform all the audiences that Ms. Uma Mahadevan was not able to join us for this event. However, she has sent a small note for all of us. I will read it out now. Uma Mahadevan says, in Karnataka, Gram Panchayat task forces have been a platform for COVID management in rural areas. They have carried out science-based awareness generation, managed quarantine, testing, tracing, and isolation, livelihoods, vaccination, and relief. This has been possible because of convergent work of over 90,000 elected members, 80,000 Panchayat staff, 1.5 lakh frontline workers, as well as local NGOs, civil society organizations, and volunteers. There have been many learning along the way. The rural elected bodies are now poised to take more proactive steps to promote public health. On behalf of the RDPR department, I thank IPH for its contributions towards Karnataka fights Corona. And that's the message from Ms. Uma Mahadevan, Principal Secretary of RDPR, Government of Karnataka. I now hand over the panel discussion session to Dr. Prashanth. Over to you, Dr. Prashanth.
A very good afternoon to each one of you, and a welcome to you all on the occasion of the 16th annual day of the Institute of Public Health Bangalore. My name is Prashanth and I'm a researcher and faculty at the Institute of Public Health. I head the Health Equity Cluster, which is a small group of researchers which focuses on health inequities research, and live and work out of a public health research field station that the Institute has established in Chamarajanagar district in southern Karnataka. We are honored to be joined by each one of you on this occasion and are grateful that you are spending this time marking our annual day. One country, one pandemic, but diverse experiences given the diversity of people, diversity of regions, diversity of ideas and interests. Take, for example, the example of adult men and women, children, migrant workers, urban poor, or Adivasi populations in forested locations. These are, for example, some of the population groups with whom the Institute has been working with, and each of them has had a very different experience in this pandemic. So we felt that to mark our annual day proceedings, if we can try and understand and listen and interact about the diversity of experiences of different population groups, perhaps it could make our science and research more socially relevant. So it helps us ensure that we don't straitjacket our solutions such that people have to fit them, but rather push for a negotiated solution that emerges through understanding diverse perspectives and experiences. It is towards this kind of understanding that we have invited the panelists to deliberate on today. So the format will be as follows. I will introduce each panelist, followed by 5 to 6 minutes of opening remarks from each one of them, after which we hope to be able to exchange based on the themes brought up in each of their opening remarks. I invite each one of you to please share your comments and questions on the YouTube live stream, where my colleague Kanika Chaudhary is closely monitoring and will make these questions available for our panelists, and we'll post that to them at the end of the panel discussion. So with no further delay, let me proceed to introducing our first panelist, Dr. Vishal Rao, who is the head of head and neck surgical oncology and robotic surgery at the HCG Cancer Center in Bangalore. He is well known for the invention of the OM voice prosthesis, which is a $1 speaking device for throat cancer patients. His invention has been widely profiled in media and is one among 100 global social innovations of this kind. And Dr. Vishal has been an international advisor to the World Health Organization's tobacco-free initiatives and is a visiting faculty at the Johns Hopkins University leadership programs. But especially for today's conversation, Dr. Vishal is also bringing in his perspectives in being involved at various levels in giving public health policy inputs to the government of Karnataka. Very warm welcome to you, Dr. Vishal, and over to you. We'd really like to hear how you experience the pandemic and what your inputs are with respect to the ongoing pandemic.
Thank you, Prashanth, and to all the IPH staff, faculty, and the students. I wish you all a very happy 16th year anniversary for all the efforts. I've been a part of IPH, I think, for now almost a decade that I've been watching all the activities, and I've had the opportunity to learn tremendously from IPH and the programs that you all have been conducting. I think at this juncture, I would like to start by recalling the words of Winston Churchill. Way back during the World War II, he told something very beautiful, very emphatic. He said that, when asked about Russia, he told some very emphatic words. He said, it's a riddle wrapped in a mystery within an enigma, but perhaps there is a key. So that was precisely what COVID was for all of us. Riddle wrapped, within a mystery and within an enigma. And perhaps there was a key. So this riddle, I think the hallmark of this riddle for us was that it almost all of us went wrong. I cannot say a country, a government, a particular organization that got it all right. And that was the real hallmark of this particular pandemic. And I think the world's biggest public health organizations went wrong. It questioned the very foundation of what we look at today as health. And for me, the way I looked at this was, I called it in one of my articles, which I wrote as an op-ed, as the World War C. You cannot but imagine to say that a few grams of this virus, and if you calculate the weight of this virus, it weighs 0.85 attograms. Just a few grams of this virus brought the world to a standstill. You cannot call this anything less than a world war. Now you call this World War C. How many lives did it take? And there are a lot of lessons that we learned from this entire pandemic. For me, there were a lot of lessons that I learned. And a lot of unlearning that I did. One of the things that came to our mind when we were discussing was, were we the virus and was Corona the vaccine that came to us? Did it try to teach us something of what we are going wrong in the way we were living ourselves? Did it teach us about is there a conscious capitalistic way to approach? Did it teach us about the need for more collaboration than competition? And I think there were a lot of learnings wrapped into this entire COVID pandemic. And I think through the panel, we are going to be making out and bringing out a lot aspects of this. But I would like to highlight before I close and say that there was psychological impact, there was economic impact, and there was behavioral impact. These are the three hallmarks of impact of the pandemic. And among the three, if you see, no governments or organizations or countries got it all right. Some chose health, some chose economy. At the end of it, we had to strike a balance. India was such a complex area where we did not know how to do it, because anything you do would be wrong, because there was no one single right answer for one group. So having said that, I think we played our part. We have tremendous learnings from this entire pandemic, a lot to contemplate on. And I would say before I close that the post-COVID era has to be a different one for us. I think because it has really made us relook into our strategies of where we stand today, and the post-COVID world for India is going to be different on various areas that we are going to be speaking about in the coming few minutes in this panel. Thank you very much, Prashanth.
Thank you very much, Vishal. One thing that certainly you flagged is the post-COVID world, and I think we must revisit that. Somewhere at the end of the first wave, after the previous annual day, IPH had organized a kind of a thinking workshop where some of us tried to imagine what would it be like, this post-COVID world. But I don't think we even came close to conceptualizing that, and I think we still aren't. But let's come back to that. Thanks very much, Dr. Vishal, and we'll come back to some of these themes that you've opened up. Next, if I may, I'd like to go to Dr. Harini Nagendra. Dr. Harini is a director of research center at the university, at the Azim Premji University, and leads the Azim Premji University Center for Climate Change and Sustainability. Over the last 25 years, Harini has been at the leading edge of research examining conservation of in forests, but also in cities of South Asia, from the perspective of landscape ecology and social justice. So being an urban ecologist, some of you might have already come across her essays and readings, especially on Bangalore. Her writing shows an acute awareness of the ecological issues in relation to human well-being, looking at ecology not especially as something separated out from human lives. So I think your perspective, Dr. Harini Nagendra, will be very interesting to on this topic. So over to you. What are your thoughts on this whole thing?
First of all, thank you so much, Prashanth, and everyone else for the invitation, and wishing IPH an excellent 16th anniversary celebrations and the years ahead. So it's I think this panel is fascinating. I already have a lot to reflect on from Dr. Vishal Rao's presentations. I am looking at, as an ecologist and as someone who started looking at climate change recently, what do we learn from, COVID, one thing is a pandemic. And we hope that, well, we never know, but we hope definitely very fervently that we are through one phase of it and the next year will show us the way beyond this. Now, the way beyond this, I think we need to start reflecting on how do we future-proof the world so that when we have future crises, we are able to deal with them and use the institutional memory or the knowledge that we have all gained collectively to do a better job of dealing with planetary crises like this. And in that, it becomes very important. I think the IPCC just released its 7th report. There's been so much discussion about how this report warns us of the serious dangers of climate change down the line. Right? And one of the things, so far, many of these reports have been in silos. The IPBES, the Intergovernmental Panel on Biodiversity and Ecosystem Services, which is also an intergovernmental panel which brings together hundreds of scientists across the world, has done a separate set of studies on biodiversity. The Intergovernmental Panel on Climate Change does its studies on climate. There are a number of bodies working on pollution of the atmosphere. And yet we know that these are all interconnected planetary boundaries. And the planetary scientists working on this have been warning for a while that we are headed towards a cluster of multiple tipping points, so to speak, which are societal and environmental planetary level collapses from which recovery will be impossible. How do we deal with this going forward? I think it's very telling that if you look pre-pandemic, a lot of the discussions of where the first tipping points would be, nobody mentioned a pandemic. Of course, we knew a pandemic would come at some point, and there were separate, WHO and others who have been warning people working on health of the possibility of a pandemic. But planetary scientists who have been talking about tipping points were not thinking about a pandemic. And I think, to me, what this really tells us is that we're entering such a complex era where we are messing with the world's planetary systems at such a global scale that we don't have complete knowledge of what we're going to see, even in the nature of what problem is going to arise, let alone forecasting when it's going to arise and what we can do to deal with it. And this is a problem, as we've seen, that that leads to behavioral consequences. Because the world at large, humanity is not wired to deal with uncertainty, uncertain futures, and therefore making decisions of what to do under an uncertain future. It's very easy for people to wear seatbelts in their car, to convince them to wear seatbelts, because it's not going to 100% prevent you against an accident. You're definitely not 100% sure that an accident will happen, but you're still willing to take that inconvenience of wearing a seatbelt, most people. But you're not willing to take the inconvenience, again, most people, or many people, I would say, of having 2 vaccines because you think that you're not sure you might get it. If you get it, what will be the success rate? If you are protected, how much will you be protected, right? We make different, when we think of scientific uncertainty with engineering, somehow we're wired to deal with it. If you think of scientific uncertainty in the medical field or in the planetary field or anything with ecology, we demand best evidence and best knowledge from science before we're willing to act. And that becomes a real problem. I think we've really seen this here, that even when you know that certain medical knowledge is clearly telling you their best guess. And it is a guess, but it's the best guess that a lot of people are putting their heads together. Public at large is not willing to believe it. And I think one way of dealing with it is saying public doesn't know, but one way of thinking about it is humanity is not wired to think this way. How do we do a better job from schools education upwards to doing better societal education to understand how to understand fake news, how to understand what is correct, how to understand uncertainty, and how to understand that we're living in a deeply interconnected world where things will become even more uncertain, but action is even more quick and urgently required. So I think that to me is one of our biggest learnings. How do we prepare people for these future shocks? That said, I think there are some ways we can prepare in terms of the research at least needed. One thing we really don't know is pandemics will play out in cities in a huge way because of the densities. And urban ecology can be a protection, but it can also be a contributor to it. And we have no idea of the intersection. So for instance, there have been some studies with epidemics, mosquito, especially vector-laden epidemics, that we're not very sure what the role of livestock is, especially people who sleep with livestock, let's say in low-income settlements. There have been some, at least anecdotal evidence that says things like dengue and other kinds of diseases may be spreading less in these settlements because maybe those are passive reservoirs, livestock, maybe not. Right? There are other studies that say certain kinds of rainwater harvesting practices, which we are trying to encourage in these informal settlements and other wealthy areas, lead to stagnant water, which lead to certain kinds of mosquitoes becoming more, which lead to outbreaks of dengue. So something that could be a positive human behavior leads to negative consequences. This is in the context of epidemics and vector-borne epidemics, but I think this has powerful consequences. It just tells us that there are so many gaps in our knowledge that we really need to address these, because I think the learnings from these will apply to a number of different kinds of diseases. Another thing we don't know about is what is the role of human density. Now, with a number of colleagues from different parts of the world, we did this study which came out as a comment in Nature a few months ago during the end of the first wave, I would say, where we were looking at what was the spread in different cities. And we found, yes, density was one explanator, but definitely not the complete explanator, because many very dense cities like Hong Kong and Singapore have been spared so far the brunt of the disease. Right? So it seems like the governance plays a huge role. And if you don't have a handle on human behavior, we have much less of a handle on governance. There's a lot of data now from Indian cities, Indian districts. I think we can put that very powerfully together to start looking at comparatives to understand when we say you need good governance, what do we actually mean? What are those elements of good governance that we can implement, at least in the Indian context? And I think that's simple to do. And then I'll stop here with just the final thing, that we are going to get other challenges. The Zika virus is already moving because of the changes in global warming, essentially, and changes in the kinds of temperature regimes we see. If you think of temperature plus heat plus humidity plus flooding plus climate change plus urban heat islands, and how biodiversity plays out in all of this, I think we realize there's so much we don't know, and we need to start putting some of these data sets together. Especially for India, there's nothing that we know. So I think we need to start really collaborative efforts. So I think IPH has places like IPH have a great role to play in bringing many of us together to start working on these issues.
Thank you very much, Dr. Harini, Nagendra. Several themes which we take note of, especially the focus on intersectorality, which also links a bit to what Vishal was saying on collaboration versus competition. We seem to have lost and invested a lot of energy in individuals competing for excellence versus people coming together and acknowledging with humility the several things that we don't know, despite all the signs, like you point out. What comes to mind is this recent comment in BMJ. I think it's on one of the BMJ blogs, the British Medical Journal blogs, where they talk of the whole narrative on idiotizing communities, idiotizing people, calling people idiots and using all kinds of humiliatory kind of language to frame some people as having wrong behavior or undesirable behavior and then showing hard signs to say that, this kind of behavior and look at these guys kind of thing. And I think this is really something to really reflect upon. If we really seek behavioral change across populations, is hard science evidence really going to take us there versus engagement, etc.? Let's come back to that after we listen to Dr. Roopa Devadasan, our final panelist for today. Welcome, Dr. Roopa. Dr. Roopa is a medical doctor and trained in public health, who is now turned a yoga teacher after 12 years of practicing medicine. She has been teaching science and yoga to children. She has been a teacher and has conceived and founded educational institutions that innovate and expand learning for children. And apart from her perspectives as an educator, she has also been paying close attention to various social aspects of the pandemic, and hopefully will also be bringing that into today's conversation. Roopa?
Yeah, thank you, Prashanth. Again, like the others, I would like to wish IPH all the very best for the future. 16 years has been a long time, and I was amazed at some of the things that have happened during the pandemic. So congratulations to the teams. I might sound philosophical in what I'm going to say, but I don't mean to sound philosophical at all. I'm speaking from a completely practical perspective. So please don't take my comments as coming from philosophy. Okay. I'm going to start out by saying there are certain things which are absolute facts. Right? However much our human brains, as Harini pointed out, are not wired to accept these facts. Okay, fact number one, we live in fact, the only certainty in life is uncertainty. That's a fact, right? So everything we do, when we take past data, when we take past experiences, when we do all that, we convert it into learning and we try to project, it will always be limited by modeling, always. Because the experience that you undergo at that time, I mean, to quote Heraclitus, you never walk the same river twice. You do not. Okay, that's a fact. And we somehow fool ourselves into ignoring that. The second thing is, we are all going to die. Okay, I mean, I'm saying this very starkly, but we are born, we will die, right? So then, this brings me very, very directly to the point of what do we do with a human life, and what is the purpose of education in the human life? I mean, I think for me, the pandemic has been, you are inundated with stories, you're watching things, you feel helpless because your mind is telling you, no, this is the way they should have done it. I mean, it's like Vishal said, nobody got it right. No, any one entity or group got it right. So then the question is, if I am in the field of education and I'm coming from a field of public health where I'm saying health is really physical, mental, social, spiritual, I'm looking at that spectrum, then what is my role in the present moment, and what is my, what do I do? I mean, where do I go from here? And here is where it's like a catch-22 situation. When you want behavioral change, right? Children don't learn from facts and classrooms. No, they watch adults around them, and subconsciously they imbibe almost 75 to 80% of adult behavior, right from young childhood. Okay. So you ask anybody, they'll tell you, there was one inspiring teacher in my life who did that, and that's what did something to me, or whatever. If you look at any human being, it's like that. So how on earth do you look at, the other thing it threw up for me tremendously was what we call science and the virus, which I'm trained in allopathy. It's not that I haven't had that background, versus traditional ancient wisdom about just taking good care of your health and being mentally sane and fearless in a way, right? What does all that do to boost my immunity? What does it mean when I don't have this this fear of the pandemic and the fear of death and whatever. How do I approach life in that context, as opposed to, I have relatives who have spent the whole year and a half going nuts watching news and reading the newspaper, literally. And I can't tell you what it has done to older people who have been cut off from all their social systems, things that they have thrived on for 60, 70, 80 years. Just the fact that you've isolated, it's done something to them. To the little children who are sensory deprived, I have twin nieces, okay, who are all of 3, and who have gone out and played in the mud twice to the park. Okay, so I'm highlighting all this because I'm just wondering, do we go to extremes? Do we clearly see that it is never going to be a one size fits all situation? It isn't. So what is the role of science, hard science? What is the role of traditional wisdom? Where does this assimilate in a child? Does it create conflict? Do we always create for children an either or kind of situation in their mind where they feel, oh, my grandfather talks rubbish and this is what it is, which you would have also in what, like you described in say an Adivasi background, as opposed to a modern, an approach. How does all this kind of sit in the human brain and finally come out as action or non-action? I mean, for me, these are in a way, the mysteries, and these are the challenges, because I'm beginning to think that no change in the outside world, however much we practice and we don't practice, we investigate and we question and we record and we report. I'm not saying all past, this thing has to be forgotten, but how do we make sense of the whole in what both the previous speakers have described as an interconnected world? If one thing this virus has proved, it is proved that we are all of one universe. We are undivided, right? It has shown us clearly that there's no way we can escape that fact. It is an undivided world naturally. Forget all the stuff humans have put on it, right? Maps and geographies and visas, and forget all that. In the real world, even there, you look at, I was just teaching a 13-year-old yesterday, and his eyes lit up. He said, Auntie, photosynthesis and respiration are opposites of each other, isn't it? So the plant kingdom and the human kingdom are opposites. They are, and I can't tell you, those kind of insights and behaviors are what is going to help the young ones of today in a very, very uncertain future. I mean, it's not enough to just know that. You'll have to go and plant a couple of things, go see a couple of birds, take a couple of walks, right? You have to do all that. And I think I'll stop here. I think I've raised enough.
Thank you. You've raised quite a canvas, and one thing I want to pick up from that is many of the things that you said, if I might provocatively frame, seems to be opposite to the push towards specializing, towards the specific kinds of knowledge production that is also probably very much needed. But I think if I look at one big theme emerging, the push you are saying for wisdom, for that kinds of knowledge which are more ingrained in societies. This is also very contested and very and is creating a lot of tensions these days, because on one hand you have this quest for hard science evidence, validated, tested, and on the other hand we know, like you said, take the Adivasi communities and many other communities which depend heavily and rely heavily and find safety in kind of knowledge systems which are more native, which are more indigenous. And perhaps another theme that comes there is also the push towards decolonized kind of knowledge, because we also know that knowledge production has also been heavily influenced over the last several decades by particular ways and methods which have been privileged over others. So very, very, very interesting, and thank you for those remarks, Roopa. So there's really plenty of themes that I really would invite you all in the same order to come back on, but four particular ones, if you wish. This is not something, it's really left to you what you think. One commonality that clearly comes is intersectoral work. How closer are we, be it climate change like Harini brought up, or be it just COVID-19, the fact that science has to be intersectoral, as well as community engagement, be it work between panchayats, schools, health departments, medical colleges. I don't get a sense that we are getting there. We are only making small strides in academia with frameworks like One Health and Planetary Health, but we know how things are on ground. So that's one. Second, I think a theme that comes is science and public engagement. Very, very tense space. There's so much on English-speaking social media, tensions between evidence, clashes between scientists and doctors and non-scientists, questioning evidence, and WhatsApp and all of this have only created further contest on what is true, what is valid, that kind of thing. So what role for science in public engagement as we move forward? Third, something that is somewhat touched upon is how things are very unfair, and often that is not acknowledged. It is all of us do not lead the same lives. We live in a society where the experience has been traumatic for some and only a minor discomfort for others. So how do we engage with that? And finally, the theme that some of you brought up on wellness and feeling safe versus preventing illness, the classic public health thing. So these are just a quick attempt at sort of locating four themes, but I invite in the same order Vishal, Harini and Roopa to share further thoughts and reflections on this. Over to you, Vishal.
Thank you, Prashanth. I think broadly, to start with, on the question that you raised first, I often say this in some of our discussion that COVID-19, one of the symptoms is loss of sense of smell. But the other more important neglected one is loss of common sense. A lot of us lost it, during this pandemic. And I think from the highest order till the lowest, a lot of us lost common sense. And I think that was one of the hallmarks of the COVID pandemic. At every wave, we had science tested to its limits. I cannot say we ever achieved a p-value anywhere in anything. We were all searching for a p-value everywhere, and I think it was COVID. I think ultimate conclusion was statistically that COVID was one of the most common causes of statistics in the last 2 years. It contributed highest to statistics but nothing else. Now, fundamentally, when you look at science in this, it was evolving very, very rapidly. But at the same time, and I'm saying that I was working at every corner from drug discovery to working in terms of understanding some vaccines, looking at some clinical studies. I had a lot of learnings in terms of one aspect that overall on average, bench to bedside medicine takes about 17 years. During this period, when you take it from basic sciences to taking it from lab research to taking it to clinical work, preclinical studies, animal studies, and from animal studies going on to case control studies, phase 1, phase 2, then comparative trials, phase 4. On an average, if you look at literature, drug discovery path takes 17 years. This time we created a hyperloop. COVID-19 hyperloop was created where bench to bedside medicine happened in less than a year. So we would say 17 weeks was the timing from 17 years. Now, this is a lot of learning to us. I was talking to one of the drug controllers and he told me, he said, sometimes, the drug that I sanctioned now, I would see it in the market 2 decades later when I've retired. So that was the story. But this time we learned from science that we had to shed that particular avatar and take up a new one, because time was an essence and we had to create a hyperloop. It was like a Formula One Bura racetrack that 1.8 seconds you finish a racetrack, you finish a pit stop. No, you did not have the legacy of time. And COVID made you rethink it and rethink it in many unique ways. And one of these things, I think the greatest contribution would be to rethink that science would need to be funded as much as that of defense. And health would need to be funded as that much of defense, because most countries give topmost priority to defense, then to infrastructure, and last to health. So overall, when I used to interact with a lot of people who are HNIs, people who are investors, big corporates, they would tell me, you know what, we are rethinking and we are talking health now, because we understood that health is a priority. But that, in a very paradoxical way, brought me to a very I would say fundamental question, something which Roopa also raised and Harini also brought up. One gentleman, I don't want to name the gentleman, very senior gentleman, asked me a question. He said, Vishal, do you think that the COVID response was overall good? And I said, I can't say good or bad. Each one had its response, but I said, I think it was adequate. Globally, everybody responded well. He said, do you think that happened because this particular virus affected the affluent classes? Because if this was a disease that would have been restricting itself to a small group of neglected group of poor people, would you have had the same response? It made me rethink that day and say, yes, maybe he had a point. He had a strong point in what he made. Because today there are so many such neglected areas which I'm rethinking. If we would give the same fervor and the same energy as what we did for COVID, maybe we would have solved the global problems of health much, much faster than what we would have done. But we did not. We consciously did not. We created projects so that they sustain the problem, not to solve the problem. So I think a lot of rethink has to go in our approaches, I think, in the coming days. And I think another point which I think I really appreciated, which Roopa said, I think one of the things for us was we needed to remain productive during the time of COVID. We had to remain productive. The question was, it asked us to rethink. And, in this time of productivity, the question was, how are you going to remain productive? And each one had to re-innovate. There was no mantra. There was no single mantra that governments could guide you. You had to rethink your whole strategy, whether it's education, whether it is sports, entertainment. I'm saying everybody had to rethink the way. There was no single formula. There was no blaming anybody. There was an unknown force at action that told you rethink, just survive yourself. And for us, each one of it was a unique way. And in this, I think the one important learning for me was reverse mentorship. How did the startups teach the corporations? How did the youngsters who are the more agile teach the more mature elder generation? How did my students teach the professors? It was a rethinking, because maybe if you would have given this entire problem to the younger generation, they would have solved it better and faster. I don't know. There was a time for us to rethink on this entire thing, that the generations to come may relook at us and say, look, you people did not do the right thing because you were stuck. And possibly one of the reasons we got stuck was education itself. Education was a hurdle that created this for us, because we were taught into thinking that this is not the way to do it. And I think I'll close with the one point that, governments across WHO kept talking about 5 T's, test, trace, treat. Then the other 2 T's of teamwork and that of training. They forgot teamwork and training. They did all the other T. The last 2 T, I think, were the most relevant for the world. We couldn't do it very swiftly. Teamwork and training, we suffered. There are countries of the world that have an emergency minister. There are countries of the world that there are centers for pandemic preparedness. Why not relook at this? Does this cost so much of money when we can build buildings over a month, when we can build corporations, when we can create ports, airports? Can't we create such a center even today? Tell me, after 2 years, have we created one? Have we created one state-of-the-art center of pandemic preparedness for the future, for the next 10 years, that we're going to target that India will never face this again? We'll have better teamwork and training. We've not done till now. And I think that is where we'll have to relook the thought also, that science everywhere across the world, I must tell you, I've been interacting with at least more than 10 countries during this pandemic. Every country told me one thing, that science had to go and stand before the corridor of politics for clearance. We need to rethink this. And I think somewhere priorities will need to be given to research in doing this. I mean, I'm just on a broad note to say that globally, this is the problem. Thank you.
Thanks, Vishal. You bring back the idea of governance. I think you foreground that. And one thing I note on your note on reverse mentorship, that also requires a certain humility among the seniors or the more, more higher ups to be able to open up to younger minds. And nowhere else other than climate change has the voices of the younger people been more strident for the earlier generation to change. And your powerful point on problems like anemia and malnutrition, for example, to what extent have we treated them with the kind of urgency and agency that COVID triggered? And we still know in India how severe a problem anemia and malnutrition are. So that's a good segue perhaps to you, Dr. Harini. What are your thoughts?
A lot of fascinating ground. I'm trying to think of where I would try to begin. I think I'll pick up from your anemia point, Prashanth, to talk about, I was very excitedly reading about the recent malaria vaccine tests. And it seems like this combination of malaria vaccine plus a few antivirals dosed for 3 months can have 70% death reduction, in which they've tested in children in particular monsoon seasons in some parts of Africa, which is great news, but it did take so long. I mean, malaria, how long have we had malaria? How long have we realized that we needed to have a vaccine for malaria? But it's a question of who's dying from malaria and which parts of the world. So yes, I think it's very clear that because of COVID, we managed to find that it need not take us 14 years to get a vaccine. It could take us 14 months. And hopefully now with this idea, we could develop new vaccines for other kinds of very urgent problems, which continue to kill a lot of people. For instance, we know the whole TB epidemic, what are we going to be? We know that it's become much worse because people haven't been able to go to primary health centers during the first and second wave, right? So how are we going to deal with this? Or possibly new polio outbreaks. So there's a lot of health treatment that has not been done, from very basic things like anemia, checking of pregnant women onwards, which we really need to address. And what I am hopeful of, I don't say I'm optimistic about, but I'm at least hopeful about, is that the networks that we have built, because networks are not just, of organizations. Networks are very crucially of people and their knowledge. That hopefully we can pick up during new crises, because there will be new crises, especially with climate change coming up. One thing we saw through Azim Premji Foundation, all the different groups that we were working with in terms of the relief work in the first wave, they were all closed. Various governments, from BBMP here, War Room, etc., to all kinds of state governments, national government. All of that got dismantled after the first wave. But it was so easy to pick them up in the second wave. And I'm sure you've all seen this, because people know each other. It's finally people that make the networks, right? So can we make sure that we don't lose those people-to-people connections somehow? I don't know how we will do that, because people get busy back with their daily lives. But if we can figure out how to keep those physical connections of people strong, then we will have institutional connections that we can pick up with for the next crisis, whatever that next crisis is. The other point I want to pick up is that of communication. And I think you're very right when you talk about the standard approach that people are idiots. And of course, people are not idiots. They're dealing with their daily lives in the ways that they find best. I think it is a failure of communication at our end. That said, if I look back at India's experience, in terms of very basic things like vaccine hesitancy or what drugs to take, I think there is a far greater trust of science and of the government, clearly. I mean, it's been very surprising that countries like the US and across Europe have, or Australia, all the countries that we thought had such a good science system, there is so much vaccine hesitancy and mistrust. Maybe it shouldn't be that surprising at all, after all. But it shows you clearly how vested interests have taken over those governments. And it shows you that despite a lot of the misgivings we had, we've actually maintained trust in science and trust in the best doctor's advice. So that's one thing that we really should be proud of in India. The second thing then is, masks, for instance. It's difficult for people to follow mask etiquette, definitely in India, but I don't think anyone discounts the fact that you need masks. at least at a governmental level. Very basic things that, for instance, many Asian countries got right. And a lot of that was because of experience. I'm leaving India out of this now, but let's say Taiwan and Hong Kong and many of these other countries, Japan, why could they put mask mandates very quickly in? Because they had that experience from SARS, from MERS. And so people knew that masks were important. Recently, I was reading one of the very leading scientists in the US, an epidemiologist, saying that, yes, we knew that masks were important somewhere back in December, January, and it was important for the spread, to reduce the spread of COVID. But we thought we should not say this publicly because it would take masks away from the frontline medical workers. So we continued with that line that you don't need masks. And you remember there was this line for a very long time. And so it again comes back to the idea of intersectionality. Here's someone who knows maybe epidemiology, but doesn't know human behavior, definitely doesn't know supply chains, and doesn't realize that you could have just built that supply chain to produce masks. If we could do it in India, they could definitely have done it in the US. So people who have knowledge in one area become supposed experts who can propound in all kinds of other areas that they have no expertise in. And that is really what we need to build. So if I have to come back to consolidation, to the way forward, I think we have to rely on these networks of people that we have built who appreciate each other's expertise and are willing to say, I'm an expert in this, but I don't understand X, Y, Z. I think I understand it, but I'm happy to be proved wrong. Please come and prove me wrong.
Thank you, Harini. And that's very interesting because in our work in IPH on health systems, we try to push both in our teaching as well as practice that health systems are not just those, governance, supplies, medicines, etc. And it's not a supply chain issue of getting things into place. It's how do you build caring systems? So the values of caring, and when you talk about how it's the people who make the difference, and they remember, and the networks, it brings back to how many of these systems and responses are situated within people. Whereas often we are looking for, very technical solutions, some kind of structures, etc. And your comment on intersections and expertise, and I think I guess it's directed at us, at the scientific and academic community to have the humility to say, okay, I am an expert on this, but I don't understand so many other things about many health problems. And I think that's really something.
I just wanted to add one thing there. I think often social scientists, I'm now making very broad typecast statements and people can attack me later, but social scientists typically have the humility not to comment about science, but scientists have no such humility. We think we have the hubris to comment on everything related to society, right? So I think that's something we need to keep in mind.
That's a useful stereotype. And of course, there are exceptions, but yes, very important stereotype, which I think I concur. Over to you, Roopa. What are your thoughts on some of these comments that you're following?
Yeah, it's been a fascinating discussion, and so much of what both the speakers have said have resonated quite deeply. It's not at a superficial level. I'm talking about there is something called content. In education, there is the content of what you learn and teach. And then there is the other part, which is how do you think? Okay. What is the process that you inculcate? So do you encourage children to ask questions? Do you encourage children to work in teams? Right? Look at our entire education system, which is set up for some industrial age 300 years ago, and we're following it, right? You look at the ridiculousness of what are the questions being raised in the newspaper? Should NEET be done? Should the 10th, 11th, 12th marks be consolidated? Is this really important in a future where climate change and all is going to be the most important thing for survival? Are we purposely like ostriches burying our heads in the sand? I'm not sure. So I get very confused when we say we, because I don't know, I don't fit in any of these. That's why I asked you the question this morning also, when you said, what have we done? Am I an educationist? Am I a doctor? Am I a parent, a daughter? What am I, right? And that's where that core thing of the person or the people, see, that's why we go back to the people connection. And that is I think the most crucial part, because if you can't bring up a child with an open mind, who's willing to ask questions, it's not social skills you put in place. It has to be a universality of approaching a problem together. It's a thing of that's what Vishal is talking about when those what are those two words he uses? Teamwork and training. We fail at teamwork and training because we don't educate our children in this. We don't bring them up in the nourishment of that atmosphere in schools, right? You do that in school and you've got an adult who understands the value of it. It no longer becomes soft skills. I get furious when they talk about soft skills. You know, are they really soft? Right? All the problems we have in intersectoral work are because we can't communicate to each other, and because we don't have the humility to say, I don't know, or can you please tell me, right? So what is I think somewhere we have created this idea that all knowledge, first of all, we have created the idea that knowledge is all important. Okay. We have not put knowledge in its correct place to start with, right? That's why when Vishal says we get stuck, the older people get stuck because we are stuck with our knowledge, right? Everything he said about you, if you listen to him, he kept saying, I learned so much. I learned so much. It is the learning mind that is all essential in this entire business. It's not anything else. It's the mind that is willing to learn. And for that, you need to reorient the whole educational system, right? We've got a system that puts all the thing on content, and that's why it's such a mess, right? So the education for the future, I mean, I'm speaking from there, it becomes it becomes so central. This when Vishal said from 17 years to 17 weeks, that hyperloop, right? That shortening, it happened because of circumstance. It happened because it was the whole world. It affected the rich and the poor alike. Is that why we did this? And then the usual problem we have of the politics of health and the politicians themselves, right? We don't want to go into that area because it's very murky and dirty. We all like to stand aside and say, that's them and we are this. So when do we take responsibility as complete human beings? And unless we as adults of this generation show that, the children have nothing to look to. What will they look up to, right? They're going to turn out like us, and we've made a mess. Sorry, I'm coming out strongly, but I feel that, right? The pandemic has shown us the mess we have made. Right, I'm stopping there.
No, thanks, Roopa. I'm really afraid we won't have time to go into the questions that have come up on chat. So before I ask for very brief closing remarks or messages, because it's impossible to summarize these conversations, so I'll let the conversations speak for themselves. So I just wanted to highlight the kind of questions that came had to do with data availability for examining climate change and taking on that challenge. And there was also questions about some stuff that Roopa brought up about making philosophy more practical, and how much are we willing to care for people and the planet, and how do we stubbornly stick to growth and development illusions on the other hand. Some themes like this which have come up, I just wanted to do justice to them by mentioning them in the panel. But I would then, because we have to move on, I would like to invite brief closing remarks or any messages, brief messages that the panelists have to IPH and perhaps the wider health and social science fraternity, if they will. Vishal, Harini, and Roopa.
I think, Prashanth, we've got a good summary of the entire discussion. I think it should close by saying that the new approaches will be a health in all policy approach, and a lot of emphasis in the future should be on looking at the social determinants of health also, and looking at emphasis on preventive health and preparedness. I think those are the future targets for us. and lot of emphasis on research and not copying from the West, but actually putting energy and time and human effort to encouraging the research ecosystem in the country and building it up. Thank you.
Thanks, Vishal. Harini?
I'll build on that by saying one of the things I found very useful during this time was the number of public data sets that people put up, whether it was on death rates or infection rates or all kinds of other related parameters. And that is what people have used crowdsourced knowledge for a lot of things. So linking up to Vishal's other point about young people, which Roopa also pointed to, I think these are things that we've understood, that younger people have put together most of these networks. And that is something, that kind of crowdsourced information, if we can get together for all sorts of other health related challenges, which, people are there now and they know how to access these systems and put them together. So I think we should have these calls for some kind of, crowdsourced calls that we could put together. And we should really think of how to do that to address a few important health challenges.
Thank you. Thank you, Harini. Final words, Roopa?
Yeah, I think my message would be, if you don't live what you're talking about, in some sense, and I don't mean, go back to the caves. I don't mean, it's about having an authentic voice, right? When you are true to yourself and you are working hard and you understand your place in society, the world and the universe, all these other things fall in place. As questions, understanding, willingness to listen, all this will be part of it. So if as researchers, as educationists, as public health people, as people who want to care for the community, if that is somewhere live in us, then it will transmit itself willy-nilly around. So I would say, before we point fingers at X, Y, and Z, let's just do it for ourselves. That's my last message.
Thank you. And on that note, I really, on behalf of the Institute of Public Health and all of us, I would like to really thank Dr. Vishal Rao, Dr. Harini Nagendra, and Dr. Roopa Devadasan. We will look back at the proceedings of this panel discussion to perhaps guide some of the work that we will continue. Thanks a lot.